Hi, this is Dr. Nick. I'm the incrementalist here with incremental insights for better business, better health.
And I'm Fred Goldstein with Accountable Health here, helping employers set up their employee health improvement programs and also working in COVID. Nick, we've tried to get off this topic. It just doesn't seem to be possible. I could say unbelievable week, but really tragic. You know, we're seeing the Delta virus go out and about all over the place, and we're seeing this mask, no mask, mandate, no mandate. What's the deal with masks?
Well, masks don't work, Fred, right? Let's start with masks work. And, just as a piece of evidence, put COVID to one side, look at the incidence of flu last year for the whole year, both in the southern hemisphere as well as the northern hemisphere. It was almost negligible. There were no cases. And why was that? That was because we were wearing these things. We had these masks and we were using them, and they were highly effective. They're effective on two counts very specifically. One, they do protect you, and two, they protect other people. And we are struggling to get this message across. There is excellent studies done by people that focus on the flow of air particles. I think, we've reached sort of common use terms for droplet size, aerosols, different versions of transmission. And the reality is that these masks, even if they are just cloth-based, are effective. They're effective at preventing these droplets, because that's the way these virus particles get out, is that they're on small droplets of water or aerosols. If you don't remember, please go back to all of our videos where we explain this in detail. It's all about size. And then finally, we have these N95 masks. And what's special about these more than anything, not least of all, is the material and the density, but it's the fit. And those people that haven't worn them, this is my original mask that I use, they come with very tight elasticated connectors that allow you to really tighten, and they are form fitted. And one of the tests that we go through unofficially is if you can smell things, if you can smell smoke, for instance, that's around, that would be the official smoke test. When you've got this on, it's not fitted properly, so the smoke particles aren't getting through. Masks work. And right now, because we don't have vaccines widely distributed, we're implementing in some places, but not everywhere, mask requirements, because that is our only methodology beyond physical distancing to prevent the spread of this disease.
Yeah, I think people really need to recognize the importance right now. We didn't get the vaccine rates up high enough. And so this virus is out there, and wearing masks, even if you're vaccinated, when indoors or with activities with a large number of people, is obviously very important. I can tell you one of the things I've seen recently, two smaller businesses that I work with, one an automobile repair shop and the other a restaurant, both closed. They're out of business because their employees all have COVID. And I noticed, within the activities they did at work, they were not wearing masks. And it's frustrating, but think about the economic impact of that. A way to reopen this economy is to be safe in those situations where you could potentially get the virus. And that means wearing a mask in those activities. And if you do that, it makes it relatively more safe to reopen and operate certain things. So I think it's a critical area.
And we've said it many times that this, I wear a mask not just for my protection, but for your protection. I am, contributing to the greater good. Do I like wearing these things? Hell no. I can tell you it's no fun. But having experienced it both in the medical profession, but also out in the community, that is the responsible thing to do. And I know that this creates all sorts of stresses for folks, and it's CO2 buildup. Let's be clear. If you haven't seen the video of the anesthetist who essentially kept putting masks on, and he had a pulse ox, and his pulse ox didn't waver, and I think he managed to get 20 on before he just couldn't get any more around his ears. There is no evidence to suggest that you can't breathe. Now, is it harder to breathe? And from an exercise standpoint, that was my worst experience. But I always took the positive on this and said, look, there are people that do this. They call it altitude training. There is a mask that you wear that builds up resilience to your lungs and makes it so when I took my mask off from the training in the gym when we were finally allowed to, wow, did I feel completely open. I just felt my lungs were in excellent condition. Take that attitude if you can. What else is going on, Fred?
So the other issue, obviously, is there's becoming more of a push for vaccine mandates. We're seeing the government look at that, obviously federal workers, we're seeing healthcare systems do it, and I understand there's also some potential for visitors as well. Nick, what's happening there?
Yeah, so nothing's happened yet, and understand all the freedoms and liberties. But one of the items that I saw that I think we can comment on very clearly from a precursor or pre-instance is the requirement for vaccines for people coming into countries. I can't comment on other countries. I can tell you that they impose those vaccine requirements. If you have ever gone to Africa, and I had a big fight online with somebody who said that I was lying about the number of vaccines that I'd had by the age of 12 because it was an extraordinary number. I had lots. Do you know why? Because I lived in Africa. I was born in Africa, and I had to have yellow fever amongst a whole bunch of other vaccinations. If you didn't have your yellow fever vaccine, and I can tell you, I didn't know I had it because I was a little baby at the time, you weren't allowed into those countries. I think we're going to see the same thing potentially, and there's some talk about the US doing that. I know there's going to be pushback on this, but ultimately this is not a new instance. This is part of public health policy and trying to prevent the spread of disease internationally.
Absolutely, and we've seen the requirements of other vaccines for people to attend their schools, etc. So I think at some point it may come about. You're also seeing restaurants now looking for it before you come in certain states. So I think it's certainly a possibility. One other area to briefly touch on, Nick, which is really disheartening, is what's happening with children.
If there was anything that really is distressing, it's seeing young people in intensive care and indeed dying. We have seen a tilt in terms of the age group. In the previous pandemic explosion, it was all in the 60, 65 plus. It's now tilted the other way. It's now averaging out at about 30 to 40 years old. And what's important there is if that's the average, you've got all of these people in the younger age groups. This is hitting them, and it's hitting them in some instances, in the case of under 12s who aren't eligible currently based on the safety, and the coverage that the authorization has allowed for. They can't get it, and of course they're exposed, and they're being exposed to this highly transmissible Delta variant. And we're seeing them as a direct result, and they're ending up in hospital and in intensive care. That is a tragedy that should just not be allowed. So if you wanted to do something, you could wear this to protect your kids, your families, friends, all of the younger generation that we depend upon for our future.
And I'd also just quickly point out, at least anecdotally, what I've seen from some doctors and has been written about is that many of these children do not have comorbidities or other conditions, and they're ending up in the hospital. Certainly a really tough situation. So once again, another fantastic week, Nick. I'm Fred Goldstein with Accountable Health. If you'd like any more information, please reach out to accountablehealthllc.com.
And this is Dr. Nick. I'm the incrementalist here with incremental insights for better business, better health.